In this interview, we hear from Bryan. He's 26 years old, living on Long Island, New York. He was an EMT turned patient care tech and now is a critical care nurse. He shares what his career journey has been like. Let's get started.
I'm excited to hear about how you found yourself in the career field of being a critical care nurse. So, if you could kick everything off by telling me where you started with your education and your experience.
Sure. So I did my 4-year degree at a public institution. Towards the end of it, I figured out I wanted to go into healthcare, so I started applying to PA schools. I got a degree in It was a degree in neuroscience, and so from there, I finished my prerequisites. I also got my EMT certification my very last semester, which would have helped me get all of my clinical experience and my hours that I needed for PA school applications. PA as in physician assistant. Then after I graduated, I started working in a physical therapy office, which helped me get more clinical experience as well as working as an EMT on the side.
Mhm.
From there, I got a job at the hospital as a patient care tech, and that I figured would be the best way to get my on-hand clinical experience that I needed for my PA school applications. When After a few application cycles, I figured out I don't think this is going to be working out. It's just not something that is really working for me. I haven't been accepted anywhere, so I figured I went to the route of nursing. While I was working as a patient care tech at the hospital, that's when I realized what nurses actually do. I had a very solid understanding and grasp of what they do at the hospital. And that's when I realized, hey, this is actually a very cool career path. And I started looking into options like that as well.
Mhm.
And that's when I started going to a program that allowed me to finish my degree within 2 years, nursing program, while I was also able to work throughout the program as well, which allowed me to apply all my principles, all my classroom theory into real practice.
Mhm.
I know that that's what clinical's for within the nursing program, but it was cool to be like on the other side of it as a tech and see like everything that's going on and just apply that alongside with my nurse coworkers.
That's awesome. Now, I know we're going to focus a little bit more on nursing, but can you speak a little bit to what the role of a patient care tech looks like and how that kind of lent to your skill set now?
Sure. So for my specific hospital, they train all the patient care techs to do all the stuff that a nursing assistant does. So like bathing, toileting, cleaning patients, making sure that they're comfortable, have tending to their day-to-day needs, such as feeding or anything of that nature. They
Mhm.
also teach us technical skills such as checking blood sugar levels, so like a finger stick level. We also do blood draws and we do 12 lead EKGs, which is like the electrical scan of your heart.
Mhm.
We also are learned how to read telemetry strips, which is the cardiac monitors. And that's not something that they teach like most at most hospitals, but at my specific one, since it is a designated heart hospital, they teach every single one of the staff members that have a patient care impacting role to know how to do this because they value all of their employees to know how to do this in the case of an emergency.
Awesome. So I think, I don't know if I missed, if you described this at all, but as a patient care tech, was there a specific unit or floor that you worked on?
I work on a medical surgical floor, which so we get a lot of post-op surgical patients that are stable, a lot of medical patients that require medical monitoring or just medical management.
Mhm.
But within my specific role as a patient care tech, we also can float to other floors such as the emergency room and the intensive care units as well.
Awesome. And now that sounds like a really kind of stressful environment.
Mhm.
How do you handle that? Because I'm sure the patients themselves are probably, a little
The,
unhappy with their situation, but then I'm sure like there's family members and stuff like that.
You kind of just learn to roll with it. Like the more you work in a specific role, the more comfortable you get with it. I
Mhm.
say that you are necessarily comfortable in a role until you're there for a couple, like probably 2 years.
Mhm.
But then like you're not necessarily confident in your role, which is when you're actually like good and not actually good, but like actually know how to handle certain situations without having to say, I'm not too sure, let me go get someone else to help you with that.
Yeah.
And it took me about like 4 years to be like confident in that role and just know like how can I can handle these family members, how can I handle these questions, what's the best way to answer these. uh, basically answer them in a way that you don't introduce any conflict and just basically help calm them down, help calm their nerves. A lot of the times they say, wow, these nurses and techs started taking care of me. They look so young. Like, how do they know what they're doing?
Mhm.
But a lot of the times they don't realize, like, a lot of people are fresh out of school. They still have that fresh skill set.
Mhm.
They're still applying it to the real world. But if you show them that you have that confidence in your job role, then they become much more at ease.
Awesome. And now, based on your own experience, like I guess this is a personal opinion question.
Mhm.
Are you happy that you spent a couple years kind of figuring it out to get to the specific role you're in now, or do you think it would have been a lot nicer or better or fun if I went nursing right off the bat if I had just magically known?
So I think if you know 100% you want to go into nursing straight, like just go straight for it. However, if it's something that you're like on the fence about, I working at the hospital was the most invaluable experience I've ever had. I would recommend it for every single person that ever has a patient care role. I always recommend them working as a tech at first because it helps you build your basics, it helps build your foundation. You can build upon that. You really learn like all the different roles in the hospital, and
Mhm.
especially just learning like within my specific hospital, you can work within like any unit. So it helps you realize like what specialty you want to do as well.
Mhm.
So, but I work on a med surge floor right now.
Mhm.
So that's when I realized, hey, I don't really want to do med surge. Like, let me start working and doing extra shifts in critical care in the emergency room and see how I like it. And then that's how I fell in love with it. And that's how I started applying to those critical care residencies and how I got to where I am now.
That's
Because
awesome.
that's how I realized, hey, this is actually really cool. I really enjoy doing this. Like, I know med surg is usually like the stepping stone to go into critical care, but
Mhm.
I knew that was something I didn't want to do, and that's something that I wouldn't have realized if I didn't work in a hospital setting
That's
prior.
awesome. I know. I feel like a lot of people kind of I think they have an idea of what they want to do or
Hmm.
specialize in, and they just kind of go for it. But I think your approach of like testing it out first makes a lot
Hmm.
of sense.
And especially like for nursing in specific, a lot of people don't have that clinical experience beforehand, and they get to the clinical sections of their coursework, and they're like, "Oh God, what did I get myself into?" And they're like, "Oh no, I have to finish my degree because I've spent all this money taking these classes, but I don't know if this is what I want to do anymore." But the best
Yeah.
part about it also is that there's so many different career paths in nursing. Like, you don't even have to do specific patient care bedside. Like, you can do anything.
What is your work-life balance like? Are you working nights? What's your schedule? How are you handling that kind of thing?
So for the last 2 years, I worked part-time. So I did three 8-hour shifts as a tech, and my hours were 3 to 11.
Mhm.
And I went to school full time. So some semesters it was 4 days a week, some semesters it was 6 days a week. But in terms of my work-life balance when I'm not working, I still keep up that 3 days a week for 8 hours, which is still part-time, and occasionally pick up extra shifts to meet that full time.
Mhm.
But I find that I'm very happy with the schedule I have now. Once I do start my new role as a critical care nurse, I will be working 3 12-hour shifts, and I will
Mhm.
be working overnights from 7 p.m. to 7 a.m.,
Okay.
which I much prefer. I always prefer doing the overtime on the overnights from 11 to 7 as a tech because I hate waking up early. So I was never a morning person, so I'm glad I'm working nights.
That's awesome. And now we're kind of on I guess, the upswing from the pandemic. What was your experience like working during such an unprecedented time, especially as like a healthcare worker?
It was one of the worst experiences of my life. Like, me and a lot of my coworkers have PTSD from like what we've seen, everything that we had to go through. Like, people say we signed up to be taking care of these very sick patients, but they don't realize like we saw death on a day-to-day basis. Like, on a normal day, we see people die on a like once a month type of basis. So it's like, yeah, it sucks type of thing, but like it happens and you kind of cope with it and move on.
Mhm.
But seeing it around you all the time and seeing so many people die so quickly and nothing you can do about it,
Mhm.
it takes a toll on you. And especially when New York was hit so bad when it first started. We didn't have the resources available to us that we needed,
Mm-hmm.
especially like equipment, supplies, and we even had to rent like one of those refrigerator trucks because we just had nowhere to put everyone once they passed.
Mm-hmm.
And so it was really a tough time. And once we finally saw things going on the upswing, we were all very excited to say, like, oh, this is starting to turn for the better. Like, let's just keep up our hard work. We
Mm-hmm.
basically supported each other the best way we could.
I guess pulling out of that thread, are there any specific personality types that you feel do well in a healthcare field? Since you do have to deal with a lot of stressful events.
I feel like you need to have a strong personality when you work in healthcare, especially working as a nurse, because you get pushback from all sides of the like all sides of the coin. You get pushback from the patient saying they want this, and this done, but the nurse can't prescribe things, so they have to call the provider, such as a doctor or the mid-level, like a PA or an NP, and say, "Hey,
Mm-hmm.
this patient wants this, and this. Like, can we give them this?" And then they get pushback from the provider saying, "Hey, I don't think we can do this." But then the nurse has to advocate for the patient and say, "Okay, if we can't give them this, what can we give them something different? Can we try this or that?" Basically saying like, this isn't working, can we try something else? And then you also get pushback from, sometimes you have those techs that just don't want to do anything, and you get pushback from them saying, hey, like, I can't do this because I just don't want to. And you have to like stick up for yourself and for your patient and say, well, this needs to get done, like, you need to do this.
Mm-hmm.
And like, if you don't have like a backbone, like, you can get pushed around, and people will take advantage of that, and they'll pick up on that very quickly.
Mm-hmm. No, I know some people who are going into the nursing field that have like I guess a sweeter disposition.
Mhm.
Are there any sectors or specialty areas that you think are better suited to individuals like that?
Mm, I mean, I always say start off in med surg if you don't have like the experience prior.
Mm-hmm.
You will have those very tough shifts, and you will have those times, but it's going to help you grow as a person. I
Mm-hmm.
myself was I was not confrontational. I was very timid when I first started,
Mm-hmm.
but working in med surg and like the field I am, it really helped me like make my voice grow and just say like, this needs to get done. Like, it helps me like basically grow as a person as well. I never
Mm-hmm.
realized like how much like confrontation like you would, it's not like, the way I'm saying it is like, it sounds like you have confrontation like every single hour of the day, like every day, but it's not like that. But like,
Yeah.
you will have those times when like you need to speak up.
Yeah, awesome. Well, I think you already shared tons of great advice for people interested in going into nursing. Is there anything else that you would say to a past Bryan who is toying with the idea of going further in the medical field?
I would say I wouldn't do anything differently. I think I'm very happy with the career path that I've chosen. I'm very happy with like the timeline that it took to get there.
Yeah.
It helped me grow significantly as a person. It helped me with my curriculum, being able to apply everything, seeing everything that I'm learning and applying it to real life practice. It really helps solidify like what I'm learning, and it really helped with my uh, exams and studying. If I had to go back and change anything, I wouldn't do anything differently.
That's awesome.
Even working as an EMT, it helped build my foundation and do like my rapid focus assessments.
Mhm. That's amazing. I love it.
Mhm.
Awesome. Well, Bryan, thank you so much for your time today. And I
Of
hope that this
course.
helps out someone who's interested in getting into nursing.
Thanks for having me.